benefits I see from InsuFlow are multiple. I like the fact that I'm getting humidified air during my laparoscopy cases. I think that it affords some improved pain control, and I particularly like the new access port that provides for improved insufflation from a 5mm or 8mm trocar.
And thanks to InsuFlow, my life is a lot easier. I actually have been doing a lot more laparoscopic procedure with less complications and much better patient satisfaction as far as pain. The patients have less pain, and they actually seem to have less scar tissue formation.
I would say in the last 4 years since we've started using the InsuFlow regularly, I've seen a dramatic decrease in post-op pain. I've been quite surprised. I would walk into patient rooms the first post-op day and the patient's dressed sitting on the side of the bed ready for me to discharge them. A dramatic decrease in post-op pain.
As far as post-op pain and recovery goes, I am an OR nurse. I do not actually recover the patients, but we get a lot of feedback about how our patients did through the night from the nurses overnight. It's amazing. Our patients are generally ready, waiting on our doctors to show up early in the morning to discharge them. A lot of them are standing in the halls, drinking coffee, looking at their watches, waiting to get out. So I've seen an unbelievable recovery on our patients for the better. They are having less pain. It's minimal invasive surgery. They're, like I said, ready to leave the hospital, usually even before the doctors make the early morning rounds.
So what I've started to implement during my surgical procedures is the InsuFlow technology, which not only warms the carbon dioxide that goes into the abdomen, but it moisturizes it at the same time. Just yesterday, I had a case where we didn't have the InsuFlow hooked up due to a technical error in the operating room, and I couldn't understand why my camera with the robot was continuing to fog. Finally, I said, "Are we hooked up to the InsuFlow?" And they said, "Yes," but then when they checked it, it was not. And as soon as they hooked it up, no more fogging. When I'm doing my surgery, there's less smoke. The tissue stays moister. The tissue stays moister. So there's less tissue damage, less tissue desiccation when I'm doing my surgical procedures that sometimes can take 1 to 5 hours. So when I'm in there doing my procedures, as I said, everything that I do, I want to maintain the best environment for my patient to have the best outcomes that I can.
The impact on our patients is mostly in terms of postoperative pain. So if they have less of that shoulder pain, less of that annoying chest pain and neck pain that comes from a pneumoperitoneum, and they're able to get up and walk around the day after a sleeve or a bypass, or the day of the sleeve or bypass, then they're feeling better. Right now, 90% of our patients go home the very next day, feeling good, walking around. They don't have that typical pneumoperitoneum pain. And that makes a big difference. If they're not requiring doses of morphine and other narcotics, even hydrocodone ends up having bad effects on their bowels, constipation, nausea. So if they're able to move around with any modality that doesn't include a narcotic, that's what we're trying to achieve.
There are some people that think if you're going to do a short case to not utilize the InsuFlow technology. But I look at it that, as I used as an example before, if you leave your eye without blinking for just a short amount of time, that tissue is going to be affected. So whether your surgery is going to be 20 minutes or it's going to be 4, 5, 6 hours, I really feel, in my opinion, that the InsuFlow technology should be utilized to keep that tissue as warm and moist as could be.
I think that in general, the InsuFlow products or the Synergy product, you know, at the end of the day, having humidified air, there's no downside. It doesn't hurt anything. It's like putting in local anesthesia into an operation. There's really no downside. There's only upside. There's no reason not to use the device.